Today we are going to talk about EPM in horses, which stands for Equine Protozoal myeloencephalitis. This is one of the big neurologic diseases to know because it can look different from horse to horse. The most common cause is Sarcocystis neurona, and less commonly Neospora huggisi. The opossum is the definitive host. Possums shed sporocysts in their feces, and horses become exposed when they eat contaminated feed, hay, water, or pasture. Horses are considered dead-end hosts, meaning they do not usually spread the organism to other horses. After ingestion, the protozoa can cross from the intestinal tract into the bloodstream and eventually reach the central nervous system. Once in the brain or spinal cord, they cause inflammation and damage to nervous tissue. Because the lesions can occur in different locations, the clinical signs are often asymmetric, meaning one side of the body may look worse than the other. Clinically, EPM can cause ataxia, stumbling, weakness, muscle atrophy, especially over the gluteals or face, dragging toes, cranial nerve deficits, facial droop, difficulty swallowing, abnormal gait, or poor coordination. Some horses look mildly off, while others become severely neurologic. Diagnosis is based on history, neurologic exam, and testing. Serum testing can show exposure, but exposure does not always mean active disease. CSF testing is more useful because it supports infection involving the nervous system. Veterinarians may use antibody tests such as SAG2 for Third-Zelisa, Western blot, or IFAT, and they interpret results with the clinical picture. Treatment should start early. Common antiprotozoal options include ponazuril, diclazuril, or sulfadiazine plus pyrimethamine. Anti-inflammatories like flunixin, phenylbutazone, or sometimes corticosteroids may be used depending on the case. Vitamin E is often added to support nervous tissue, especially if there is muscle or neurologic damage. Prognosis depends on severity and how quickly treatment begins. Mild cases treated early have a better chance of improvement. Severe cases, recumbent horses, or horses with long-standing neurologic deficits may have permanent damage. Prevention focuses on reducing opossum exposure. Keep feed sealed, clean up spilled grain, protect hay and water sources, remove carcasses that attract possums, and limit wildlife access to barns. Key takeaway: EPM is a protozoal neurologic disease of horses that often causes asymmetric signs. Early recognition and treatment give the best chance for recovery, but prevention starts with keeping opossum contamination away from feed and water.